from the local station, News 4 Jax starts now.
A 16-year-old being treated for COVID-19 at Baptist Hospital has died. The CEO of Baptist says the teen had no underlying health conditions and had not been vaccinated. We're also told both of the teen's parents are hospitalized, presumably because of the coronavirus.
News 4 Jax is learning more about the number of people dying from COVID-19 here in Jacksonville. UF Health says just yesterday, 3 of its patients died of the virus, raising that hospital's death toll in just the first 4 days of August to 12. Compare that to 37 COVID deaths in all of July and just 4 in the entire month of June. At Baptist, we just learned that 119 people have died since late June. News 4 Jax has been asking other hospitals for their numbers, but right now the administrators are not releasing that information. The state government has stopped releasing data on where in Florida COVID deaths are occurring. News 4 Jax reporter Jim Pickett leads our coverage on the pandemic at 6 o'clock. He's joining us live from Baptist on the South Bank. Jim?
You know, those numbers of deaths are a surprise to many people, particularly that 16-year-old. But actually, we are not getting a true picture of the real number of people that have died in the city. We know people are worried, and many being tested for the virus today say they just want to stay safe.
Well, it's got me concerned because there's a lot of people that have COVID and a lot of young people that are dying, and all ages from COVID are dying. And it's got me concerned that I don't want to get COVID and pass away from it.
At UF Health in Jacksonville, they're seeing a sharp increase in deaths. In June, 4 people died from the coronavirus. In July, when the surge began, that number jumped to 37 deaths. Now, just 5 days into August, 12 people have died, 3 of them yesterday. During a teleconference today with local elected officials, Dr. David Cairo told them he expects to see many more deaths.
We're starting to see our death rate climb, and that kind of expected because the mortality rates will lag a little bit behind the infection. Our mortality rate, thankfully, isn't as high as it was at the peaks last time, but I'm also worried that we just haven't seen the end of it because of how fast the infection rate's going up. The numbers of patients in the ICUs are so high that I'm worried that we're going to start seeing deaths come out of that group soon.
And just this afternoon, the head of Baptist Health talked about the number of people who have died at their 5 facilities since late June.
We've seen 119 deaths in our facility, and it's very devastating. In fact, today I'm very sad to share that we lost an adolescent in our children's hospital of 16 years of age to COVID.
We've been checking with other local hospitals like Ascension St. Vincent's. They've not released those numbers. During the discussion today at UF Health, hospital staff was asked if an end to this surge is in sight.
We might have been seeing a slowdown recently, but the estimates that we're hearing say that we're probably going to see a rise again with the continuation of this current wave.
And that could last for another 4 weeks. And you know, we know hospitals have been making room, adding additional rooms and ICUs. They've done that at Baptist at some of their facilities. But during that teleconference today at UF Health, they also talked that they moved some of their ICU across the street from their main campus. Also, we'd learned there, too, that the average stay of a COVID patient at UF Health is 8 days. 10 days for those in the ICU. And right now we're told that the average age of a patient is 54 years old. Staffing at all hospitals have been a problem, but at UF Health, 131 of their staff are in quarantine right now. For now, we're live on the South Bank. Jim Pickett, Channel 4, the local station.
Jim, thank you. A doctor at Baptist is reacting to the tragic news that a local teen has died from the coronavirus. Dr. Sunil Joshi works tirelessly to give the community information about the pandemic. Joshi says just absolutely sad for everyone involved. We have to get past the inaccurate and overplayed assertion that COVID is insignificant in children. That is simply not true, in particular with the Delta variant. We just got off the phone with Dr. Joshi. He's going to join us live at 7:15 tomorrow morning with what parents should know about having their child vaccinated.